This is Dave. Today we're going to talk about postpartum depression. It actually is quite common. About 25% of all females deal with this after having a baby. It's more than just quote unquote baby blues, although those are real as well. You can experience anxiety, fatigue, feeling overwhelmed, weepiness, depression, guilt, hostility, irritability, a feeling of hopelessness, self-consciousness, hostility toward your spouse or significant other, as well as hostility toward the baby, panic attacks, appetite changes, decreased libido, migraine headaches, thoughts of harming yourself or others, reduced concentration, sadness, difficulty bonding with your new infant, withdrawal from both family, friends, and activities, insomnia, which of course you're going to have anyway with a new baby, but it even makes it worse, and then a lack of interest in the things that you once enjoyed that were fun for you, hobbies, events, things like that. First off, you have to realize what you've experienced is a huge life-changing event. You've brought a new individual into this world. Not everybody can do that, and it's going to change your life in a lot of ways. As a female, you're going through a lot of hormonal changes after you've given birth. Your body has been building up energy for two people, not just you, and now suddenly you gave birth. Now that little one's not inside you anymore. Yes, you may be breastfeeding, but your body is going to undergo some huge hormonal changes, as well as your life. You're going to get less sleep naturally because you have a little one in the house that will be crying, that wants to be fed, that wants to be taken care of. You have more responsibilities. You've got a new human to take care of. You may have some more financial responsibilities as well. You also are going to have people that may have been focused on you being the daughter, maybe the sister, maybe the wife, the girlfriend. Now they're focusing on the baby as well. And for the last, 6 to 9 months, you've been the one that's pregnant and you've been the focus of attention. Well, now they're turning it towards somebody else, and by all means, you don't need to be left out. However, that's a natural occurrence that does happen. So things like the baby blues can occur. Those start right after delivery. Generally, with the baby blues, you experience a lot of the things that I just mentioned. However, the symptoms are mild. They're understandable. Like I said, a huge life event. The symptoms are difficult to deal with, but they do go away after about a month. However, postpartum depression is more serious than that. The symptoms are severe, can be debilitating, can function or can affect how you function in your life at work, as well as with family, as well as just your general well-being, and it doesn't go away after a month. Postpartum depression can actually start when you're still pregnant. So if you're starting to feel these feelings come on at all, or these symptoms and signs that I discussed, or you want to notify your provider right away so you can get on top of that. You may not be able to start treatment for it because you're pregnant during the time, but they can watch out for that right after you've given birth, okay? Along with that, causes of postpartum depression. Number one, it can be genetic. If you have a family member that has had that, you want to be watching out for that in yourself. Second thing, if you've had it in a previous pregnancy, you're more prone to have it again, so be aware of that and watch out for that. You also can see that with more in women that have multiple births. So if you're blessed to have twins, triplets, quadruplets, you want to be aware of that. You may be at a higher risk for that, okay? If you have a history of depression or bipolar disorder before your pregnancy, you're going to be more prone to having postpartum depression. If you had a stressful event that occurred during your pregnancy, a family tragedy, maybe a loss of a job, maybe an unfortunate medical diagnosis, that is also going to make you more prone to having this. If you're going through some financial struggles or financial trouble, or if you're having trouble with your significant other or spouse, that will make you more prone to this as well. So you want to be aware of that as you're going through this. Some counseling during the pregnancy, if you're going through those kind of difficulties, is a good place to start. If you happen to see that you are having difficulty bonding with your baby, if you're having difficulty with your spouse, significant other, if you're thinking about harming yourself or someone else, you absolutely need to seek treatment right away. Some of the things that you can be started on, depending on, like I say, this can occur during your pregnancy, so depending on where you're at in your pregnancy, also depending on if you're breastfeeding or not, they may consider you putting you on an antidepressant. You want to talk to your provider. Not all antidepressants are good with breastfeeding, so that's something to talk to your provider about. There are a couple of new drugs that are out now that are used specifically for postpartum depression. Zulresso is an IV treatment that you actually have to get in the clinic or in the hospital because they need to watch you afterwards. It decreases certain hormones that occur after birth, and that is how that one acts to help with postpartum depression. The other one is an oral treatment called Zurzuvae, and that is the one that has just now been approved. Again, it's a treatment that you can use orally to treat postpartum depression. Now, you do want to make sure that you check with your provider, as I said, because not everything is okay with breastfeeding. Something else that you need to look at, if you're having trouble breastfeeding, you're having trouble bonding, you can talk to the hospital where you're at or your provider about getting a lactation consultant. If you get to the point where it's easier to breastfeed, that can help you move along with postpartum depression, as well as the baby blues that I talked about too. The other thing that you should consider is getting into a counseling group, a support group with new moms. You're not alone in this situation. Like I said, it's more common than you think. And having others going through the same thing that you are with crying baby, dirty diapers, new responsibility, no sleep, is a good idea. You can get together, you can bond, you can share, you can get ideas on how to deal with what you're going through. So having a support group of new moms is a great thing. Again, the hospital where you delivered your baby or your provider should be able to help out with that. Getting a support system started for you at home is another great idea. Let your family know what's going on. They'll be there for you to build up that support system. You've got to ask for help because as a new parent, you're going to get run down. It's a lot of responsibility, especially if you haven't had kids before, or if you have several kids at home. That's another responsibility now that you weren't used to before. So get that support system built up at home to help you deal with some of these things so you can take time for yourself, because that is another important part of treating postpartum depression and the baby blues, is actually taking time for yourself away from the little one, where you can get back to doing some of the things that you enjoy doing that made you happy, that made you feel worthwhile, so you can adjust back to having a new little one at home.